Max Wardell, overheadathletics.com. Welcome back, guys. Back here with Ethan. You've seen him in a couple of our videos in the past. One that we did on Tommy John surgery, manual therapy early on. If you haven't seen that yet, check it out. But as you can see, he's got a nice looking scar here. This is 2 elbow surgeries, and he's got the nice smiley face. This is one of the more significant scars that I've seen. And you can see it's really wide here, almost like the scar opened and dehisced a little bit. But what we're going to be doing is working on the scar with some instruments today. So I've got some rock rub on there. There's all different styles. And we're going to be kind of just doing some basic grafting over top of this scar. Now, Ethan's one where he had his ulnar nerve transposed in front of this bone right here, the medial epicondyle. So his ulnar nerve is up here, so we're not worried about that at all. Here, we're just going to get the tissues used to a little bit of pressure through the instrument, and then we'll go through a couple of our favorite scar mobilization techniques with the tool so we can get full movement. And it's not bad because we've been working on it, but full movement of this scar relative to the layers that are deep. Sometimes you can get scar tissue that resists or restrains motion and causes pain. Think of if Ethan's shirt was all bunched up and this was, his scar, it's going to pull on different vectors as he reaches in different ways. So that superficial layer can certainly limit your motion. And regardless, we'll get him used to the pressure here, and we might actually do a manipulation again on that, even though it's moving better. What'd you tell me coming in today?
Oh, it moved so much better. It felt a ton better.
Yeah, and it hurt probably pretty bad, little burning sensation when it happened. Basically, we cupped it, got it moving a little bit. I applied a manipulation proximally as I extended his wrist. You could hear that of the scar tissue rip from being adhered to various layers, and then all of a sudden the motion's a lot better. If you're looking for the most comprehensive resource on training and rehabilitation of the throwing athlete, check out my book, Arm Alloy. The link is in the description. Now, back to the video. So now what we like to do with the scar here, I like to do a little bit of a strumming technique where I pin with my thumb, and then I'm strumming the scar, and I'm kind of getting a little bit of a lift on the scar as I come through. Now you can use 2 tools for this, but I find the thumb works pretty good. The proximal scar typically moves the best, but once we get towards this elbow, you can see how when I move the tissues, there's a little bit of an adhesion there, or poor gliding and sliding of that scar. And that's where we actually can see it jump. So trying to get underneath that scar and lift it from what's underneath. Get scar tissue infiltration, fibrotic buildup that will stick to some of the deeper layers, and you can feel that right there. Feel that?
I'm numb.
He's numb, so he does not feel it. That's what 2 surgeries does, but I can feel it right there. You can almost feel a catch as you glide over it. So we're getting this thing moving. There it is again. Remember, that nerve's going to come here, but it's still coming up this way, so you want to make sure you're not strumming over the ulnar nerve. That's not going to be real fun. And then we'll work the opposite direction, which is more difficult to do. But you want both medial to lateral gliding as well as proximal to distal. So one of the things we'll do now, we'll keep working this, but just for the purposes of the video, we'll start gliding it over top of the instrument now with my thumb. So I'm giving equal and opposite. I'm gliding the skin, and then I'm pushing the instrument underneath. It's a rolling technique, but we'll take a look at this. Let's take a look here. So you can still see, even after the manipulation, there's still a little bit of a pulling where you can see this skin here getting pulled into extension. Especially if I kind of hold that skin down, you can see that it doesn't want to come with the hand. So we're gonna grab some TheraBand, or you can grab some Dyson, and we'll manipulate that a little bit. But it's way, way better than what it was. So make sure that you can get a good grasp on the skin, just drying it off a little bit. And then we just use a TheraBand here. The TheraBand's nice because as you can see, it easily grabs a hold of the skin. And as you can see, the scar is pulling distal when he extends, so we're gonna manipulate it in the opposite direction. So I'm gonna grab the scar, I'm pushing towards his elbow, and then we're gonna see if we can manipulate that just a little bit. And since we had a huge release of scar, ripping of scar tissue the other day, I don't expect anything, but you can see when I try to pucker it, it's got a flexion point there where it doesn't want to lift. Is that sore?
A little bit, but not too bad.
So we'll just do some mobilization with movement, and then we'll try to do a quick manip here.
This way, you don't have to do the big toe stretch. Yeah. Let's go. 20-second hold. I know.
With a little bit of ulnar deviation, and now we'll go with a little bit of radial. Nice.
So it's combined motion.
Better.
Post tip.
How's that feel?
Feels great.
You're gonna flip this around here.
Medial to lateral is good. We'll go one more time. I'm going to go with his elbow down here so I can extend him.
Without rotating your knee. Good.
That's the one I did on it the other day that released it. Good.
Good. I like it. Make it more of a diagonal.
Doesn't pucker quite as much when I pull it up. And that now doesn't feel like that's restricting the motion as much. So scar mobilization, a little bit of scar manipulation post Tommy John. You always have to consider where they took the graft, as well as the surgical scar or the open incision there as well. If you guys like this video, make sure to check out some of our old videos 3, 4, 5, 6 years ago where we worked on scars, showed some different techniques. Other than that, give it a thumbs up. We'll see you in the next video.